Hi, my name is Jessica Lynch, and this presentation is going to be about lateral violence and workplace bullying among novice nurses. So to start off, we need to understand what lateral violence is. Lateral violence is a form of bullying which is defined as physical, emotional, or verbal abuse of an employee of the same rank or position. In nursing, lateral violence is described as nurse-to-nurse aggression. It has destructive effects on victims both psychologically and physiologically, such as tiredness, sleep deprivation, depression, and lower self-esteem. These can affect the professional performance of nurse victims, resulting in poor patient care quality. And then to define bullying, bullying is defined as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. So this could be a nurse that is more experienced doing this to a novice nurse, which is typically within their first year of practice, or it can be even between novice nurses or between more experienced senior nurses. It's anyone that has the same job title. So another way to describe lateral violence or bullying is a common term that most nursing students, novice nurses, experienced nurses have all heard or used at one point, which is the phrase nurses eat their young. So this famous idiom embodies lateral violence as part of the nursing environment. So often this is used to describe just part of the orientation process, or it's used to kind of justify the treatment that newer nurses or nursing students experience at the hands often of senior nurses. So as most senior nurses have experienced this type of behavior, they often perpetuate the same practices towards newer nurses and simply just recite this phrase and repeat it as an explanation of why this is continuing to just be common practice. Lateral violence in nursing is not necessarily only part of the orientation process. It can occur at any point throughout the nursing career. It has been directly linked to psychosomatic symptoms such as headaches, frequent illness, depression and anxiety, reduced productivity, absenteeism, fear of going to work, impaired relationships, poor quality of life, both at work and outside of work, and has even led to suicide in certain cases. In addition, patients also suffer the effects of lateral violence in nursing, which can include poor patient care, decreased patient satisfaction, increased medication errors, and increased rates of hospital-acquired infections. All of these effects felt by patients can additionally lead to increased costs of healthcare because medication errors and increased rates of infection can result in longer hospital stays, which the hospital typically has to cover because if something happens in the hospital, it's typically the responsibility of the hospital to cover the bills for that extended stay. In addition to the patient and nurse experiences, another reason or several reasons that lateral violence or bullying is a problem is just because of the prevalence of it. So 48% of nurses say that they are concerned about being victims of bullying at work. Additionally, approximately 60% of nurses left their first nursing job within the first 6 months. 39% of nurses personally knew other nurses who were victims of bullying, even if they were not victims themselves. And 79% of nursing school graduates think that nursing schools should provide workshops and special training about handling workplace bullies. I can't think of any other profession where bullying is such a big issue to the point where graduates think that it should be worked into the curriculum for school. And finally, due to so many nurses leaving their first nursing job within the first 6 months, there's a huge cost to employee turnover. So it can cost anywhere between $22,000 to $64,000 per turnover in order to hire and orient new nurses. So my PICO question is, does workplace bullying of novice nurses in their first year influence the nurse's ability to provide patient care? So the population that was examined in the studies that I reviewed were nurses, which were both novice nurses within their first year and senior nurses with experience. The interventions included implementing zero tolerance bullying policies, simulation exercises, and mentoring, where newer nurses were paired up with a senior nurse in order to discuss any concerns that they might have, to be able to ask questions that maybe they didn't feel comfortable asking in the moment, or to simply work with any equipment that they may feel unfamiliar with. This can provide education, but also emotional support for newer nurses. So for comparison, they compared bullying in nursing as compared to other professions. Bullying in nursing seems to just be generally accepted by new nurses, senior nurses, management, supervisors. It just seems to be something that's always occurred, and so therefore it typically gets overlooked and is basically just treated as part of the initiation process to nursing. Then the outcome was that up to 50% of nurses typically experience or witness to some degree bullying of others while at work. And as previously stated, this can lead to medication errors, a reduction in patient satisfaction, increases in the cost of care, and negative effects that are felt by nurses, patients, and family members. So just if you are stressed at work and you don't feel comfortable asking questions, you might make mistakes. You might not know how to use a specific piece of equipment, but due to fear of retaliation or belittling, you might not feel comfortable asking, but that can lead to errors which directly affect the patient. Additionally, if you are stressed out at work and family members have questions that you might not be comfortable answering or may not have time to answer, responses can be short with family members, which then affects the way that they feel about the care that their family members are receiving. So when it comes to searching for resources, some of the resources that I used were the Pennsylvania College Library Summon tool, which you can narrow down original research, you can narrow down the time frame of the article, you can type in a few keywords, and you can also limit the search field to nursing, which was very helpful. Google Scholar is also helpful to find resources. It also helps to provide free articles. You can limit the search results to only find free articles. And then CINAHL Complete is another database where you can where you can be helped to find research articles that apply to nursing specifically. So some of the terms that I used while searching for articles included lateral violence in nursing, nurse bullying. I just put the quote, "nurses eat their young," and a bunch of articles popped up about that since it's so common. I also searched for novice nurse bullying, workplace bullying in nursing, and then healthcare lateral violence. So there are several ways to choose articles. I included an example of the CINAHL website here, and then over to the right through the PA College library, you can narrow down if you want peer-reviewed articles, newsletters, journals, books, or if you want book reviews. So there's a lot of criteria that you can use in the advanced search, which you can also use this on Google Scholar. So you can narrow down articles, and for this particular presentation, it was narrowed down to articles that were 5 years or less. You can find peer-reviewed articles or original research. You can make sure that the articles are relevant to the topic. So I found that the best way for me to choose articles was to read through the abstract And when I was choosing articles in the first place, I chose articles that specified original research within the search criteria. So by reading the abstracts, you can find out if these are original studies. You can see how many participants were used, the type of data collection that was used, whether it was surveys or interviews, or if it also helps to determine if it's qualitative or quantitative research, because you can also skip down to the conclusion and see if the results show how many nurses. So if this particular study showed how many nurses have experienced lateral violence but didn't specify anything else, that would be qualitative because it would show the number. But these studies that I used showed what types of violence are lateral violence and how people cope with it. So this was more quantitative because they used interviews, whether in person or over the phone. They also used semi-structured, unstructured, and fully structured interviews. And they also had surveys, which they did at work or sent to employees' homes. So there were a lot of similarities in these studies. They all focused on nurses, although in various stages of their careers, but primarily towards the beginning of their career, so typically within the first year. So if there was a nurse that was more experienced, they asked them to think about their first year as a nurse. It also all of these studies found that workplace bullying is a common occurrence, and that it doesn't really matter which specialty you're in, where your hospital is located, different cities, states, countries. It was prevalent everywhere. What type of hospital you're in, whether it's privately owned or publicly funded, and then also the nurse's age. So whether they were in their 20s, 30s, 40s, it didn't really make a difference. They all experienced bullying at some point. And all studies also made sure to maintain anonymity of participants just to help to reduce any possible retaliation. There were some differences in the types of data collection, which included various interviews, as previously stated, and surveys, which were sent to home addresses but also provided at work. And then the study by Mao included nursing students, which focused on their experiences during clinical, and the study by Chauville included bachelor's students of nursing, which had them involved in a simulation environment where they were working with an actor that acted as a bully, and then that was followed up with a questionnaire. So there are several recommendations on how to improve bullying within practices. So the first is to teach coping strategies, which is to help the victims of bullying deal with bullying, which may or may not lead to a reduction in bullying itself. Management and leadership intervention, simulation exercises, education being implemented in nursing school programs, and then implementation of zero tolerance bullying policies, as well as mentorship programs. In conclusion, it was determined that lateral violence and bullying tend to happen to newer employees of nursing and new graduates. So this can happen whether you go to a new hospital or if you're fresh out of school. This can be true in any place of employment, not only in healthcare or nursing school, but lateral violence in nursing is often overlooked and ignored by staff nurses and supervisors alike, as it is often chalked up to being part of the job and expected during your orientation process or at any point throughout your healthcare career. The studies reviewed provided evidence and tangible proof that workplace bullying is alive and well within the nursing community, despite nursing having such a focus on caring for others. Here is a list of the references for the articles that were used for this presentation. And so finally, I just want to thank you for viewing this presentation, and I hope that the information provided has helped you either understand that bullying is a common occurrence and it may not be personal, but also to help understand that newer nurses and experienced nurses alike may experience lateral violence and bullying, and really the best way is to just support everyone that you work with and try to maintain a positive work environment. Thank you.